FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz. It's June 1st, 2020. Well, the COVID-19 seems to have taken a backseat to perhaps to the civil unrest that took place over the weekend. You just wonder about people being locked away in their homes for months already, and then something happens and it just triggers a mass reaction. Not to mention the fact that there are elements who will go nameless, who've been waiting for this and have set it up. And obviously these riots were orchestrated. They found pallets of bricks delivered to each location prior to the riot, gasoline bombs, cars laden with incendiaries, all these things, not making it up. But in any event, we'll get back to the prior problem du jour, which was COVID-19, the lockdown. And of course, we got our good friend here, Dr. Ted Noel. And if you don't know Dr. Ted, he's a retired critical care physician. Dr. Ted, these are the kind of people that you used to treat, right? When you were a physician. Do I have that right?
Well, I took care of everybody that came through the operating room because I was also an anesthesiologist. But in the intensive care unit, we took care of anything and everything that came through from all causes and all sorts of extremely severe illnesses.
Yeah. So you basically were responsible for the annual flu season, right? You had to pretty much deal with that?
Well, in the ICU, we really rarely saw anybody where flu was considered to be the cause. It's just, we would see other things, where they developed a secondary pneumonia, and then we dealt with the pneumonia when the flu was already gone.
Mm-hmm. All right. Yeah. So what we're dealing with here, though, this COVID-19, we don't really have reliable numbers to figure out exactly what's going on, do we?
No, not at all. As I pointed out in one of my op-eds, if you die in the hospital and your ex-wife's second cousin had COVID-19, you're listed as a COVID-19 death.
Mm-hmm. Without any regard.
Yeah, and there's a very real reason for this. Hospitals get extra money because of it.
Right, so
their money in the big stimulus bill promoted that.
So they have a built-in incentive to pretty much skew the numbers because they're not, for at least up until recently, they weren't getting any of the so-called elective surgeries.
Oh, yeah, which is 80+% of their income.
Yes. So what are we really looking at here in terms of the actual rates? Can you make anything out of what the numbers you're seeing?
I'd use the SWAG technique, scientific wild ass guess. And the best numbers I've seen suggest that we are over-reporting by about 50%. So drop the number to 2/3. So if we're at 120K in the official number, the real number is 80.
Wow. So we're over, and even Dr. Burke said that it was 25% over-reported. And when you've got incentives and then you've made it impossible for these hospitals to sustain themselves in any other way, then you got a problem here, right?
Absolutely.
Yeah. So not to say it's not serious, but with people in nursing homes, they're in frail condition. Many of them weren't going to last the year anyway, correct?
Right. And let me pop to there's an article written by Aaron Bromage, who's a professor of virology at the University of Massachusetts. And one of the key things that this professor points out is that in essence, the risk of infection, I should say the risk of illness, has to be exposure times time. Right. Very simple. If you're stuck in a place for a period of time and you're continuously exposed, you're going to have a higher chance of getting it. And when we look at the places where it happened, where it started in Lombardy, Italy, where New York City, you're dealing with locations that have vertically oriented lodging, where you have elderly people with multiple comorbid conditions packed together, who then are continually, if you will, rebreathing the air of their neighbors. And so you have a long period of exposure. And in New York City, with the rent-controlled apartments and poor maintenance, now you've got stale air is a big deal.
And filth.
And
huge
filth. But stale air is the key point here, is that what circulation there is just locks all these elderly people into a virus incubator. Mm-hmm. Lombardy, Italy, same story. Any place you look, we're looking at 80 to 90% of all of the deaths are coming out of that kind of environment.
Mm-hmm. That's amazing. And then, all right, so I had a dispute with somebody about what Governor Cuomo did in New York State, which was effectively knowingly sending COVID-infected patients to nursing homes.
That was criminal.
I'm going back to my legal background, and I wrote an article called "None Dare Call It Murder," because at the very least, this is negligent homicide, where the parties, the actors, both of whom are attorneys, Cuomo and his health commissioner, Zucker, both attorneys. Zucker he just got admitted in 2019. I think he missed it the day that they taught law in law school. I think he skipped that class, because the definition under New York's penal code is criminal negligence. And what is criminal negligence defined? Is failing to recognize an obvious risk, or recognizing it and not doing anything about it, which results in the death of a person. And that could be like if I go and I park my car across 3 lanes of traffic on 95 and I run away, and then cars go and they crash into my car and people die as a result. That's definitely negligent homicide. It might even be worse, but that's just one example of it.
Oh, yeah. Well, if they obviously hadn't heard of Kirkland, Washington.
Yeah, the first outbreak in the United States, major outbreak, took place there. And then, that was the main outbreak. And what we're missing is that somewhere like 30 to 50% of all the deaths taking place are taking place in nursing homes, coalescent centers, assisted living facilities, senior care facilities. And you had the health commissioner in Pennsylvania remove his mother, whatever he is, remove its mother from a personal care home, which is basically, I guess, like assisted living, where they just, they don't need medical care, but they can take care of themselves, except they can't do the basic functions, like bathing and dressed and all that. But she took her out of there, which to me is shows intent and knowledge of what you're doing. Why is the FBI not investigating these people?
Well, you have to find the federal crime in that. Is it deprivation of civil rights under color of law? You have to find a good legal excuse, and you're probably going to be better at that than I am.
Yeah, well, the deprivation of life is probably the biggest constitutional crime there is. And certainly you can't look at this and think it's anything but intentional, right? I mean, it's deliberate.
Well, but murder in and of itself is inherently a state crime.
Correct.
Not a federal.
Correct. So it's civil rights.
But let's look at the contrast. In Florida, our governor, Ron DeSantis, went exactly the opposite way. If you tested positive, you were not allowed into a nursing home.
Yes.
And so he walled off the high-risk population, and we haven't had a nursing home outbreak here.
Yeah, we've had nursing home deaths because you just can't stop it from spreading. But they were tested. He sent the National Guard out to the nursing homes. And this is the guy who he didn't order the statewide lockdown until April 2nd. And he was one of the earlier governors in releasing it. Supposedly, the number of cases are going up. But what I've witnessed, Dr. Ted, is the New York Times had a map at one time in their section, and it was color-coded. And the bright orange spots were where cases were growing the fastest. And then, and you and I talked about this, then like 3 weeks later, it was diminishing because the R0 factor was decreasing and there was no doubling. So they were measuring it by how fast cases were doubling. And the orange was, the bright orange was anywhere from 3 up to 3 days, 0 to 3 days, it was doubling. And then the duller color was 5 to 7, and it went like that. Then they changed the color coding on the map when the cases declined. So all of a sudden, the 1 minute the graphic was showing cases declining, everything was fading, and then the next minute it had orange, bright orange again, because they made orange 0 to 7 days, and they kept the colors. And they changed what they meant, and they never made any statement about it. I only caught it because I'm like, am I going crazy here? I've been saying that the thing is declining. It's spread, and we know the number of cases is declining, right? I mean, in terms of the
overall, the number is we're still getting more cases.
Yes.
But they are less frequent. And this is part of us starting to develop some herd immunity. Remember, in New York City, there was between 15 and 20% positive antibody rate.
Yes.
And the Governor Cuomo was just stunned by it. He was also just absolutely stunned by the fact that all of these old people in those rickety apartments were getting sick, even though we locked them in the virus incubators, so, but I think they changed it because if you took the map and you put the orange dots and you overlaid it with a red-blue map of Republican Democrat, the orange dots matched the red dots for Democrats. And I think they wanted to change that.
Oh, yes. Yeah, it's so true. And the worst outbreaks in the nursing homes and for the states have all been in blue states. And that's just a statement of fact. It's no opinion. We're not saying why, although the nursing home thing definitely is a big contributor to it.
FSN Radio. It's all about what's next.
Osino Resources is a Ross Beatty-backed gold exploration company in mining-friendly Namibia. Osino's district-scale land package is situated near 2 producing gold mines, one of which Osino's management team previously developed and sold to B2 Gold. Osino's founders and management are experienced mining professionals who have already successfully developed and sold 2 companies in the past 7 years. Osino has a tight share structure, and with its current treasury, it can self-fund the advancement of its gold discovery into at least 2022. This is an exploration company with drills turning that you'll definitely want to pay attention to. Osino trades in New York under the ticker OSIIF and in Toronto under the ticker OSI. To learn more, go to osinoresources.com. That's osinoresources.com.
The Financial Survival Network. It's all about what's next.
Well, there is a very real reason why it's happening there. And it has to do with vertically oriented housing where you have recirculating air. So people are exposed for longer periods of time. And that's in the large cities. And the large cities themselves tend to be very strongly Democrat. Hence, you have 2 independent factors that cause a confluence of events.
2 independent variables. And, it's definitely causative. We know this for a fact. And it's just the fact that, that in the northern states, right, for viruses to thrive, you need certain temperatures. And in the southern states, basically, Louisiana got hit the hardest, probably because of Mardi Gras. But Florida, with all the irresponsible, non-social distancing from all of the spring breakers, it really, relatively speaking, has not seen anywhere near
we haven't
fatalities.
Found anything from them.
Yeah.
And the problem here is lockdowns are stupid.
Yes.
You need to let the old guy go out on the park bench and play dominoes with his buddy and watch the girls. You need to let grandma be able to go to the neighborhood deli, have a cup of coffee with her friends. You know, they walk down the street. Outdoors, you have solar UV that kills all the viruses very quickly. Okay. The air, and the other thing is, if you look at movies, very quickly, I mean, I was just watching an episode of Bosch last night, and there was a smoking scene outside, and this was amazing at how long the smoke actually survived, but you saw it wisp away, and within 2 or 3 seconds, it's gone. It's spread out so far. And remember that the basic equation is exposure times time. Well, outdoors with air movement, exposure drops to nothing.
Right.
Because it all goes out. And so you have no issues. So exposure is going to be indoors. And this was shown in Guangzhou, China, in one of the first studies where you're tracking a super spreader. And if you looked at the diagram of the tables in the restaurant where this guy was sitting, the people downwind from him for 90 minutes, that whole table basically got sick. But what happened was that the air went across that table up to the return vent, through the system, back down through the vent, that then came across, and the people in the table upwind from him got sick too. Some of them, not as many, but you had a circulation where you had 90 minutes where all 3 tables were basically seated the whole time. The people downwind got more infection. The people further downwind, basically, is what it was. Some of them got infected.
Yeah, and the fact is that the number of cases they tracked like 6,000 of them, and they had one case where outdoor transmission took place. So
in Florida, we don't know about any.
Yeah, and it's really hard to ascertain some of this, but it seems like, you know, the old saying that sunlight is the best disinfectant.
It's absolutely true.
I remember
Journal of Virology, 2003.
My mother would say, "Oh, you know, you're getting a cold. Go sit out in the sun." And a lot of times, the symptoms of the cold, like, it would dry it out. I don't know what she knew, but many times, not always, but many times, Grandma, it would go away.
Knew that it worked. That's all she knew.
Hey, the pandemic of 1918, the Spanish flu, some doctor figured out that if we take these people out of their rooms, and there were field hospitals all over the place because we didn't have anywhere near the hospitals we have now, if we put them outside for 2 to 3 hours per day, their survival rate went up, and also not just the rate, but the recovery time went down. And they figured this out then.
Well, there's one other part to this. Sunlight is not just the best disinfectant. Sunlight's interaction with your skin helps to create the active form of vitamin D. And there's good research now that suggests that vitamin D helps in fighting viruses.
And vitamin A, and the two combined. And it's funny because when I moved down to Florida, I had low vitamin D, and I started taking a supplement, and it went back up to normal. And I've noticed I have gotten many less colds and many less ailments. You know, every now and then I get the beginning of a cold, and then it just stops. And
let me circle back to that 2003 article, because it was put out in the Journal of Virology, which is published by the agency Fauci heads. And yet he says, let's lock everybody inside. And of course, his consistency is again demonstrated with a big article in 2005 that showed that hydroxychloroquine was antiviral in its effects. Again, published by the agency Fauci is head of. Yet he has been poo-pooing hydroxychloroquine.
And we know, like, from studies, that zinc has antiviral effects. I've taken it before for colds, and if you take it fast enough, your cold won't last as long. It'll knock off like 3 days from your cold, and that's been poo-pooed in combination with hydroxychloroquine. as well as the erythromycin with that as well.
Azithromycin.
Yeah.
One of the big things that's in this whole debate is that there are 2 or 3 big studies now that say hydroxychloroquine does nothing. It may be harmful, but you have to look at one thing in those studies. Who were they studying? They started with patients who were already in the hospital. That means they're already quite ill. And this is one of those drugs, for example, if you are having a little bit of chest pain, what's the first thing they tell you to do even before you head to the hospital? Take an aspirin.
Yeah. Mm-hmm.
Early on, aspirin is helpful. And they have a saying, Mona greets every patient, morphine, oxygen, nitroglycerin, and aspirin when they hit the ER. But if you now proceed to an ST elevation MI, my buddy who's a cardiologist is going to be in the cath lab on your STEMI fix. Aspirin isn't going to help you there. You're too far gone.
Right.
The same thing with hydroxychloroquine. It's beautiful in the early stages, and there are marvelous studies, large series, that show that it's very effective, but it needs to be given. The moment you start feeling sick, you get it. It's very benign.
Yeah.
And cardiologists are defensively doing an EKG up front to see what your QT interval looks like. But other than that, the answer is no. People take this drug for years with no trouble. So all of that is really hyped.
And we've seen that people who've been taking it for malaria in the malaria belt in Asia.
And Africa.
Yeah, and Africa. The incidence of getting the COVID-19 is extremely low. So when they belittled Trump for taking it as a prophylaxis, it was really against their own science. And, what is their agenda here? Like, what is the point of all
Trump
this?
Derangement syndrome. That's all that was.
Yeah, but Fauci, ignoring the findings of his own department, his own center, is this a big pharma thing that we're looking? What is it? He must have some agenda. He said.
Remember, remdesivir, which has been shown to be of some effect, was developed for Ebola in Fauci's department.
Mm-hmm.
So he has a vested interest in the success of remdesivir. And whether he makes any money out of this in any fashion, you really have to question whether this has something to do with the 15 minutes of fame.
Yeah, that's the worst. That is the worst thing. If that's what it's all about, being in the limelight, but it seemed to hit him the week before last when he said, we can't have a lockdown forever. It's going to cause a lot more harm than not doing it. And what's amazing is I would credit a lot of the social unrest that's taken place over the past 5-6 days with people losing their jobs, being cooped up at home, losing it, and then they see this, and it just makes them really susceptible to blowing up and losing control and joining the fun.
Oh yeah, I mean, when you've got nothing, you have no hope. You have several possible options, one of which is suicide. Most of them won't take it, although suicides have gone up.
Way up.
But lashing out is a real easy, obvious option. And this is lashing out. This is not directed protest.
Yeah. Other than the fact there's these precipitating groups that are, starting it off. They throw the first stone through the window and get them worked up and going. And, they're organized. Well, hey, Doctor, it's always great to have you on. If you could give 3 pieces of advice to people who are worried about getting COVID-19 at this point, where my feeling is every day that you don't get it, your odds of not getting it go way, way up. Am I wrong about that?
No, you're not wrong. If you're under age 60 and you're not already sick, ignore it. The worst you're likely to do is get it like a case of flu, and you'll get over it. That's the worst likely outcome. If you've got a lot of other health issues, you may want to stay away from public, but do never be afraid of going outside. It's the safest place in the world. Go outside as much as you can figure out a way to do it. And then the third one is most of social distancing is probably worthless or counterproductive, because in order for us to get herd immunity, we have to have people who get infected but not sick. And herd immunity is created by casual contact with the virus.
Yeah.
Casual contact is unlikely to make you sick, but it will turn on your immune system and make it so that you will then become a protector of the community. So social distancing, I think, is garbage.
And I have to confess, I'm a little embarrassed because I don't want to put the curse on myself, but I haven't done like anything they've said. I mean, I've gone out, I've socialized. Yeah, I try not to stand next to somebody in Publix. I will admit that, mainly because I know they're going to get upset. I said, I feel like this just isn't my time and I don't see it. And I've been in the sun every single day, exercising, bike riding, doing everything I can to stay outside, because honestly, and if clubs were open and places were open, I would have gone. But the only place to go was Target and Walmart and the supermarket and different specialty food stores.
And
there was nothing else to do.
In Costco because they require it.
Yeah, and I try to avoid the places that require the mask because I'm not convinced about the efficacy of that. So basically, your three pieces of advice are: hey, don't worry about it as long as you don't have comorbidities. If you do, stay away and get out in the sun, and don't worry too much about social distancing, right?
Absolutely.
All right. Couldn't have said it better. Hey, where is the best place to find your work? I know I've seen your recent articles in Town Hall. Of course, you got your YouTube channel. Where's your YouTube channel? What's the name of that?
YouTube, just look for Dr. Ted.
All right.
And I post occasionally out there these days. I'm doing a lot more in print. I have published at American Thinker, at Town Hall, and at NOQreport.com.
NOQreport.com. Excellent. I didn't know about that.
Stands for News, Opinions, and Quotes.
I like that. I'm going to check that one out. Thanks for the heads up on it. Everybody out there, we're not giving you medical advice. We're just giving you common sense opinions. So don't go licking toilet seats or whatever those idiots were doing. Don't go, looking for trouble. But live your life. And if you don't have the comorbidities and you're under 60, very little risk. And even if you're over 60 with minimal comorbidities that are under control, right? Because those comorbidities generally are out of control, correct? Like blood pressure, like diabetes.
And if you want to keep up on a more than daily basis on Twitter, I'm Dr. Ted. On Facebook, Dr. Ted.
All right. And we'll have a link. Hey, Dr. Ted, it's always great to have you on, and common sense hasn't been enough of it. Too much fear. I'm a lot more fearful about the social unrest than I am about this disease. But hopefully the federal government will act, and that will be but a bad memory. But it's a lot more disconcerting. Anyway, hey, we'll talk to you again. Thanks again for coming on.
Look forward to it. Thank you.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.